All right, let's talk about the massage gun again and how to use the massage gun while we're trying to increase range of motion. So if you're using a recumbent bike, stationary bike, little pedaler that goes on the floor in front of your seat to work on knee flexion, knee extension, a great way to include the massage gun is to use it while you're pedaling. So what I'm going to do is I'm going to say, let's pretend it's my right knee that had the replacement. As always, I like to put the right knee, the replacement in first. I slide my seat forward. First thing that I'm going to do is I'm going to get the foot into a comfortable position. I've got another video that talks about the alignment. We want the knee a little wider than the hip and the ankle. From this position, when I put my non-surgical leg in and I start to work back into flexion, I want to understand what it is that I believe is blocking my flexion. If I feel sensation through the front of the knee, if I feel tightness, if I feel pulling, that is something that we can stretch. That is something that we want to work on. But if I feel pinching in the back of the knee, if I feel pure pain coming from the back of the knee, that does not mean that I have scar tissue that's limiting my flexion. This is more of an impingement problem, and it should be treated differently. So it's important that first you understand, well, what's limiting my range of motion? Right? If somebody's told you it's scar tissue or somebody's told you it's something else, just understand that if I'm trying to bend the knee, I should feel tightness, maybe discomfort in the front, nothing in the back. If I'm getting a restriction in the back of the knee with flexion, I need further assessment. I need somebody to tell me, a physical therapist or somebody, to tell me why am I getting this issue in the back of my knee. But we're going to assume you feel the tightness through the front of the knee, across the band that you feel across the top of the shin. The Theragun or any massage gun is going to be a great option, because what we're going to do is we're going to turn it on. We're going to let it sit. It still cracks me up when it jumps like that. We're going to let it sit, and we're just going to gently glide it up into the thigh. What's happening is my non-surgical leg is applying pressure to my surgical leg. But the massage gun is creating a stimulation, a sensation through my quadricep. I go on the inside of the quad, I go on the top of the quad, around the outside, and it's just giving my brain and my nervous system something else to feel. Because typically what happens when we first get into this stretch position, the receptors, the muscle spindles, they kick in and they're like, whoa, 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 what are you doing? Are you crazy? This is going to cause pain. This is going to cause damage. We need to stop. And so the muscle immediately contracts, immediately resists any motion. That's why it's so hard for a therapist to stretch your leg if you feel pain. Because as soon as you feel pain, reflexively you want to stop that motion. So I want to get to the end of the range, but not pain. And then I want to stimulate those tissues in this area so that they get a little confused. The nervous system gets confused because it feels the sensation, the vibration. And what typically happens is it allows me to get a little more motion. And then what I'll do is I would work back and forth. I call it an oscillation. I would oscillate into the end range of motion. Now let's pretend for a second that you could do a full revolution from this position. Awesome. Let's unlock the seat. Let's move it forward a little bit more. And let's go till you can't get that full revolution. And now I'm going to be in this spot. I'm going to work back and forth. The massage gun is on. I don't know if you guys can hear it. And basically all I'm doing is I'm just letting it stimulate the sensors in the tissue of the distal, the lower quad, to allow me to kind of feel almost like a numbing sensation. It's not numb, but that's kind of what it represents. That's what it feels like. Until eventually I can get into the end range of motion. I can improve flexion. Certainly, I could do something like this down into the calf muscle. A common complaint among patients is your calf is tight, right? And I think that's because of the new walking patterns and other stuff that I have in another video. But basically what you could do is you can bring this knee back toward the end range of motion. I'm applying a little forward pressure. The massage gun is on, and it's stimulating that calf muscle. It's vibrating it. I release the pressure. I come up into the high calf, the proximal gastroc, and then I work down into the lower calf as I bend the knee. And so I can do the same thing for the IT band. I can come in from the side. I can work low to high. Essentially, in theory, I'd be moving the fluid back into the system. But really, mostly the benefit is just feeling that sensation that gives us a little bit of distraction from the sensation we get inside the knee joint. Now, this is something that's typically going to be used 4 weeks, 6 weeks post-op or later. It's going to be used for somebody that's just really struggling to gain range of motion. Maybe they don't want to have a manipulation under anesthesia, and they're looking for any tiny little advantage that they can find to help them increase the range and speed up the recovery of the healing. I think there's benefit to something like this. I think there's certainly not harm, and that's what I always use when I'm judging, like, do I do something or not? What's the risk? What's the potential benefit? Does the potential benefit outweigh the risk? For a lot of things, it doesn't. For a lot of things, the benefit does not outweigh the risk. But something like this, it's generally non-harmful, non-threatening. You can't guarantee that you're not going to get hurt, but it is something that's typically perceived as safe. And so if you want to give it a try, talk to your physical therapist, try to experiment with it in the clinic. But understand, there's a huge benefit to using the gun while you're moving, while you're exercising, over just passively laying here, hitting it, and massaging. I mean, this feels great. I'm not going to lie, it feels good, but I don't know that this is necessarily bringing you any benefit other than feeling nice. But sometimes it's nice to feel nice. All right, guys, I'll catch you on the next video. Let me know what your questions are. Let me know what you're thinking. And let me know if you have one of these for home use and if it's worth it. Other patients want to know, is it worth buying one of these? This is a good spot in the hip. I'll catch you guys later.